Herniated discs, the best treatment options. Spinal disc herniation, also known as a slip disc, is a medical condition affecting the spine in which a tear in the outer, fibrous ring of an intervertebral disc allows the soft, central portion to bulge out beyond the damaged outer rings. Disc herniation is usually due to age-related degeneration of the annulus fibrosus, although trauma, lifting injuries, or straining have been implicated. Tears are almost always posterolateral in nature owing to the presence of the posterior longitudinal ligament in the spinal canal. This tear in the disc ring may result in the release of inflammatory chemical mediators, which may directly cause severe pain, even in the absence of nerve root compression. Disc herniations are normally a further development of a previously existing disc protrusion, a condition in which the outermost layers of the fibrous ring are still intact, but can bulge when the disc is under pressure. In contrast to a herniation, none of the central portion escapes beyond the outer layers. Most minor herniations heal within several weeks. Anti-inflammatory treatments for pain associated with disc herniation, protrusion, bulge, or disc tear are generally effective. Severe herniations may not heal of their own accord and may require surgery. The condition is widely referred to as a slip disc, but this term is not medically accurate as the spinal discs are firmly attached between the vertebrae and cannot slip out of place. If you have ever seen an image or an X-ray of a spinal column, you probably noticed that it is comprised of numerous discs. If you look closely, you'll see the discs are all connected and appear to be stacked on top of each other. For a better idea of what a disc actually is, picture a jelly donut. It has a very soft middle, or center, that is encased by a harder outside layer. This is similar to a disc in your spine. The jelly-like substance on the inside acts like a cushion to provide protection. A herniated disc occurs when this soft, jelly-like interior pushes through to the outside of the disc, like jelly that has escaped the center of your donut. Most herniated discs occur in the lower back, although can also occur in your neck. You can have a herniated disc without knowing it. Only a physician can diagnose a herniated disc. If you suspect you are suffering from this condition, visit an Orlando orthopedic surgeon for treatment options. Herniated disc treatment at Orlando Orthopedic Center. Herniated disc occurs when a spinal disc loses elasticity and ruptures, expanding beyond its intended boundary. A herniated disc is most often a result of a gradual age-related wear and tear, commonly referred to as disc degeneration. This means the discs lose some water content, jelly, thus losing flexibility and are more likely to tear or rupture, even under minor pressure. Most of the time, people do not know exactly when the disc became damaged. For some, herniated discs occur with improper lifting or twisting the back when lifting an object. Very rarely a herniated disc can be the result of a traumatic event like a fall. Symptoms of a herniated disc. For many people, there are no apparent symptoms associated with a herniated disc. But as the disc begins to put pressure on a nerve, then there can be any number of symptoms. Some of the possible symptoms include lower back pain, pain that shoots down the hip and leg, even to the ankle or foot, numbness or a tingling feeling in one leg, muscle spasms or deep muscular pains, weakness in one or both of the legs. One of the primary causes of herniated discs is the loss of water content as we age. This shrinkage of discs is part of the natural aging process, which cannot be prevented. However, there are a few things that can be done to help prevent herniated discs in some people. Always lift properly using the legs and not the back, and do not hold your breath with lifting. Avoid smoking altogether. Maintain a healthy weight. Avoid performing strenuous activities on a regular basis. Get back pain relief with natural home remedies from our readers offering treatment for herniated disc symptoms. The first symptom many people have is back pain, but rather surprisingly, some will experience little to no pain from this problem. In all cases, however, it is important to seek effective treatment to prevent further damage. We have done the research for you and come up with a collection of natural and home remedies to treat your discomfort. 3 of the best home treatments are curcumin, yoga or stretching, and DMSO. A herniated disc, also known as a slipped or ruptured disc, is an issue that involves one of the rubbery cushions in between the individual bones in your spine. These discs can be compared to a jelly donut, for lack of a better visual, in that the discs have a soft center within a tough exterior. The condition occurs when some of the soft fluid from within the disc pushes out through a crack in the exterior. A herniated disc can cause irritation to the nearby nerves, resulting in pain, numbness, or weakness in an arm or leg. Some individuals, however, experience no pain and the issue is only identified through spinal imaging. As conditions with the back and spine are so sensitive, it really is best to at least consult a doctor concerning treatment. However, you can treat back pain holistically with a number of home remedies and reduce your risk for further issues. Our readers have offered a wide range of alternative remedies for slipped discs and other back issues, all of which are available to you. According to anecdotal evidence and our further research, 3 of the best holistic remedies for a herniated disc are curcumin, yoga, and DMSO. Curcumin. Curcumin is the active ingredient found in turmeric. This compound is anti-inflammatory and serves as an antioxidant. As such, it relieves inflammation in the back and helps eradicate any of the excess fluid that leaked out of the slipped disc. Yoga. Yoga is one of the absolute best forms of treatment for back issues. The structured stretching not only lengthens the body but also strengthens the core, so it helps relieve pressure in the back and prevents further back issues. DMSO. DMSO or dimethyl sulfoxide is an organic sulfur compound. Sulfur compounds are responsible for creating new cells and maintaining life as well as detoxing the body. As such, DMSO is particularly effective for treating a ruptured disc. Whether you are experiencing pain from your herniated disc or not, treatment to at least maintain the strength and structure of your back is important. Give one of these options a try or continue reading below for tips from Earth Clinic readers who have tried various supplements to heal a slipped disc. Please let us know the remedies or supplements that help you recover from a herniated disc. Some of the terms commonly used to describe the condition include herniated disc, prolapsed disc, ruptured disc, and slipped disc. Other phenomena that are closely related include disc protrusion, pinched nerves, sciatica, disc disease, disc degeneration, degenerative disc disease, and black disc. The popular term slipped disc is a misnomer, as the intervertebral discs are tightly sandwiched between 2 vertebrae to which they are attached, and cannot actually slip, or even get out of place. The disc is actually grown together with the adjacent vertebrae and can be squeezed, stretched and twisted, all in small degrees. It can also be torn, ripped, herniated, and degenerated, but it cannot slip. Some authors consider that the term slipped disc is harmful, as it leads to an incorrect idea of what has occurred and thus of the likely outcome. However, during growth, one vertebral body can slip relative to an adjacent vertebral body. This congenital deformity is called spondylolisthesis. Most authors favor degeneration of the intervertebral disc as the major cause of spinal disc herniation and site trauma as a low cause. Disc degeneration occurs both with degenerative disc disease and aging. With degeneration, the contents of the disc, the nucleus pulposus and annulus fibrosus, are exposed to altered loads. Specifically, the nucleus becomes fibrous and stiff and less able to bear load. The load is transferred to the annulus which, if it fails to bear the increased load, can lead to the development of fissures. If the fissures reach the periphery of the annulus, the nuclear material can pass through as a disc herniation. Disc herniations can result from general wear and tear, such as when performing jobs that require constant sitting and squatting or driving, sedentary lifestyle. However, herniations often result from jobs that require lifting. Professional athletes, especially those playing contact sports, are prone to disc herniations. Within such an athletic context, it is often the result of sudden blunt impacts against, or abrupt bending or torsional movements of the spinal area. Minor back pain and chronic back tiredness are indicators of general wear and tear that make one susceptible to herniation on the occurrence of a traumatic event, such as bending to pick up a pencil or falling. When the spine is straight, such as in standing or lying down, internal pressure is equalized on all parts of the discs. Herniation of the contents of the disc into the spinal canal often occurs when the anterior side, stomach side, of the disc is compressed while sitting or bending forward. And the contents, nucleus pulposus, get pressed against the tightly stretched and thin membrane, annulus fibrosus, on the posterior side, back side, of the disc. Intervertebral disc degeneration is a complex disease and several genes are associated with its etiology.